As I said in my speech this morning, I was very proud to have Dr. Choung and his distinguished group of Korean doctors who are here to help the Egyptian children with the deformity called cleft lips. Cleft lips is a deformity of physical appearance, but it also hurts the children deep inside their psychology, their pride. But with the help of these doctors, they will have a brighter future for their family and themselves. And I think this is a very important project because Korea once was a beneficiary of this kind of cooperation from foreign doctors and friends. And now it's time for Korea to help other friends, our friends in Egypt. And I know there are many distinguished doctors in Egypt, but they may need more hands. And the Korean doctors are here who came all the way from Korea to help the children, beautiful children of Egypt. And then they will be proud faces of Egypt, and then they will work to the better future of Egypt. So we are here to help our friends, and thank you very much.
Yeah, you asked why selected the Egypt. Yeah, in historically, in Korea have had a very hard time. We have a Korean War. During the Korean War, Egypt helped us. At that time, I heard that Egypt people support and help the Korean people, maybe in medical equipment and so on. So I would like to thank you very much for that Egyptian support. So as a thankful mind, as a payback, I would like to visit Egypt. So collaborating the friendship cleft lip operation. I founded this friendship cleft team in 1998, but I learned that this charity operation from my teacher. Actually, my teacher made the charity team for cleft lip and palate in 1967. So, and it propagated the Korean Peninsula, and also it propagated internationally Vietnam War. It took Vietnam. So I learned that when I was a dental student from my teacher. So then from dental student, I performed the friendship operation from Korea and Vietnam and so on. So now after I become a professor, I founded this charity operation team as a one of corporation. Yeah. So then I established this team, and we performed the more than 800 patients all over the 15 countries. Yeah, maybe we have some collaboration with the KEDA, Korean and Egypt Development Association. And the chairman of the Kang is Kang asked how about the help Egypt. Actually, he is a Korean but asked more Egyptian. He loved more Egypt more very much, I think. And I'm very moved to his passion to the love of Egypt. So I moved, and then okay. And another important thing, one is exchange of the medical knowledge. Another one is learn each other, the culture. So I would like to learn the 7,000 brilliant Egypt culture also. So I'm very glad to come here.
Dr. Ibrahim Qala, thank you very much for being with us here. How did you organize this workshop, and why was Al Azhar Specialized Hospital chosen for that?
Yeah, actually, I organized this workshop. As you know, it is very, very important for such patient to be treated by this team, because such patients, such children, which complaining from cleft lip and cleft palate, does not receive the sufficient treatment here in Egypt. Now, every surgeon, every dentist treat these children alone. Our aim is to treat these children in team. The national standard suggests that these children should be treated by team, not by individual. So when we organized this with the Korean side, and that is Dr. Choung and his team agreed to came here to Egypt and perform such surgery. We are in Badr University starting to organize for their visits. I commented with many situations and many places to share us to use their operating room, but when I came here for Faculty of Dentistry at Azhar University, they welcomed the issue, and they helped us and they cooperated with us. So I organized that we defined the time for coming of the Korean team, and then organized with our colleagues in Faculty of Dentistry as the center of cleft lip and palate surgery. And then, as you see today, we organize that surgery combined with some scientific evening in sort of lecture and workshop.
How many universities are participating, and how many hospitals? As I've seen, the military hospital also, there is a representative taking part in this workshop.
Actually, in the workshop, there are many universities, nearly all Egyptian universities sharing that the workshop and sharing as the lecture. But for preparing the surgery, actually, there are two universities, which is Badr University and Al Azhar University, sharing with the Korean side.
Why do we have so many cases in cleft lip? Is it really very widespread in Egypt?
It is not widespread, as we cannot say it is widespread, but it is present in a percentage of the population, and that percentage does not receive the required care for their treatment. So it is our role and our message, I can say from here, that these categories of children should know their proper way for treatment. They should know definite places which should be responsible for their treatment. It is our duties to provide this for these children.
Mr. Kang, CADA is involved in charity work in Egypt. Could you speak to us, could you talk to us about it, and also the special event of the workshop, the 5-day workshop, in which number one surgeon, Dr. Choung, is participating in Egypt here?
Today we have a very good celebration for some operating friendship cooperation. This cleft lip surgery, our team, we start from today till 29th, up to 30 patients.
Sir, did you think so many times before coming to Egypt when you got the invitation?
Yeah, I invited actually Keda, Chairman Kang, but I'm very interested in the Egyptian culture. For more than 7,000 brilliant culture. I'm very interested in the culture. So friendship operation is, in the other sense, is based on the humanitarian philosophy and trying to understanding each other, particularly culture. So I would like to change our medical knowledge, and also I would like to change our culture, Korean culture and Egyptian culture. So particularly Chairman Kang connected the KEDA and our team KARC. So I would like to thank you to him and also Nile TV also.
Why Azhar University, and what other parties are taking part in this workshop that you invited to in the organization? I mean,
As you know, our KEDA, we the legally registered in Korean, the Ministry of the Industry and Energy and Trade, and our partner KEDA Egypt also registered in the Ministry of Social and Solidarity. Badr University is our partner company, so we introduced PUC, and PUC and also introduced consortium with Azhar University. This is longest university. We know that some more than 1,000 years ago, long history. So we are very happy to come to coordinate together. So particularly, as you know, the Dr. Choung is worldwide number one doctor in this field of facial deformity, facial the cleft lips. This was number one in the world. Harvard University and Tokyo University recognize him number one. So they have to maintain MOU between Seoul National University Dental School and Harvard University Dental School made MOU together. So we are very proud of having Dr. Choung and his team. His team also number one in this area. So we are very, very happy introducing this team in Egyptian medical the doctors and students. Maybe more cooperation, and we can support their upgrade. They make them also number one the doctors in the world like this.
Thank you for your compliment.
And also, I've been here many times. Not just this one. We like to focus on another some charity program, eco-friendly chicken farm program. Will start already. So we opening ceremony 16 December. Some farmers needed this kind of the technology and money. So we donate some money. Each family the 10,000 US dollar amount for building charity some eco-friendly chicken farm building, and provide 500 chicks and provide 6 months feed. And then we will make them the more reliant and the more independent. If they make money, they pay back to governor. They seek another the family in need. So we will expand. So next year May, we another donation here. Maybe 10 family selected. Maybe after that, maybe we have some success. Maybe 100 family we'd like to select. So make Egypt families more very good, the reliant family. This is why we, Dr. Choung also recognizes we Korea get some benefit, some donation from Egypt during Korean War. At that time, Egypt support South Korea, and then provide the South Korea with the medical, the medicine and medical equipment. So we are very some owe to a lot to Egypt. So now Dr. Choung recognizes, so Dr. Choung choose Egypt. Otherwise, he go to another country. Already Dr. Choung some charity program in 15 countries, and he some successfully operating 539 patients in the world.
800.
800. Yeah.
Okay.
800. So we love Egypt very much. We'd like to make Egypt Tiger of Nile soon.
I was very excited when I first heard about this trip. So I like to thank Professor Choung and Chairman Kang for giving us this great opportunity to visit Egypt. It's my first time visiting Egypt, and I really love the country. And the Al-Azhar Hospital has a really great facility, and they have great staff here. So we're also very excited about working with them for the past couple days, helping many cleft lip and palate patients.
Dr. Mustafa, the contribution of Badr University, especially dentistry, in this big workshop.
This cooperation between Azhar University, Faculty of Oral and Dental Medicine for Girls, and with Faculty of Dentistry in Badr University for treatment the big problems. It is the cleft palate patient. Cleft palate patients in Egypt, there is a controversy between the different doctors or different surgeons, oral surgeon, maxillofacial surgeon, plastic surgery, also pediatric surgery. It is different surgeon can be make this operation. In Azhar University, there are Azhar Center for treatment of cleft lip and palate. Have cooperation between all the surgeons about 10 specialties to treat the diagnosis and treating and management this patient. This comes with Badr University, and we make good workshop, inshallah.
How many specializations are present in this workshop in order to treat the cleft lip?
About 10 specialty, oral maxillofacial surgeon, plastic surgery, pediatric surgery, prosthetic dental prosthesis, orthodontics, pedodontist. Also, there are special doctors in this centers. It is neurosurgery as well as neuropsychiatric.
The children who are supposed to be undergoing these operations, how were they chosen, or are they just patients that came to Al-Azhar Specialized Hospital and then they were chosen accordingly?
In all pediatric hospital in Egypt, there are a waiting list, long waiting list for this type of children. Therefore, Imam Al-Akbar, Sheikh Al-Azhar, give order to make this surgery is for free for all patients, and ask other hospital to come his waiting list of children.
Dr. Ahmadi, I'd like to know, how did Al-Azhar Specialized Hospital come to host this group of surgeons? I mean, the surgeon and the group of medical doctors together, especially in your specialization.
First of all, it's as you know, this is an established teamwork for treating cleft patients, which is something we try to establish in the Middle East. One of the first centers, I consider this is this center, because gathering many specialties, and of course in the Azhar University they already helped us to do this. That's why this event is done with the Korean team. This another cooperation together with another country, so that we can give service to the patients that they need this service, cleft patients.
Here, how many surgeries are done in this cleft lip generally? Is the number a great number?
Of course, yes. This is the cleft anomaly or the cleft disease is the most numbers of diseases in the congenital disease, what they call, they are born with it, is the cleft patients. And there are many hospitals and many places in Egypt treating these cases. And here we are trying to make it more teamwork, more helping to the patients, giving them multi-service in the same place.
How is it affecting this disease? How is it affecting the life of a child later on? Because if he grows up like that, what is the future?
The problem is that the cleft, it's not a disease that you can just do a surgery or give the patient medicine and it's off. No, it's a disease that accompanies him the whole of his life, and it's treated in steps. And these steps should be done at special times. So this is the importance of that concept. If it's not done at the same time, at the proper time, and in the proper way, the patient will suffer the whole of his life. And this is the big problem in that, and that's why we're trying to establish this center, to have the concept that these patients should be treated properly from the beginning by specialized persons.
How many specializations, medical specializations, are there in order to treat this disease? Well, as I understand, it's not one specialization.
I would say minimum is like 9 or 10, but it can go up to 17, 18 in some centers, international centers. More people get involved in this, the more help and the better service they give.
As you tell me that many specialty should be needed or included in the treatment of and the management of the cleft lip and palate patients, I think from this specialty, it starts from the pediatric doctor and then the dentist for cares of the dentist and also ENT surgeon. Sometimes there is a retention of fluids beyond the drum, which necessitate drainage of these fluids. Also later on, at the age of 3 years, we start our surgery, but sometimes we need some sort of molding, which necessitate correction of some deformity involved in the nose of the patient, and we start with this mold, and then the surgery comes later for more and better benefits. Also, another specialty later on, when we finish our surgical rule, like the phoniatric, as we know also in these patients, a lot of patients, it may reach up to 30% of patients may complaining of speech disorder. So phoniatrics has a very benefit role. Sometimes we may interfere surgically to correct or share in the correction of this velopharyngeal incompetence in these patients. And another specialty also may be psychiatric specialty. Why? Because as the age of the preschool age of this child, it may interfere with the normal life as like a normal baby or a normal child. So the psychiatric has a big role for the management of this psychiatric problem, because as we know, these patients may complaining from residual deformity in her lips or in his nose. So the psychological support from a specialist and his family is more important for this condition. And later on, these patients may need what is called orthognathic surgery for advancement of hypoplastic midface of the upper jaw. and it may need later on rhinoplasty at the age of 20 years or 18 years later on. So the patient from after his delivery up to he became an adult man or female, he has many steps for the management of this deformity to be normal or near normal